Hi, my name is Ali. I am from Higher College of Technology. My major is pharmacy and I am in year 4. So I will talk about our poster, which is about G6PD deficiency, children in UAE, mother experience, pharmacist education role, and future recommendation. So about the introduction, glucose 6-phosphate dehydrogenase deficiency is a genetic disorder that causes hemolysis of red blood cell in children and adults when they consume certain type of food, take certain type of drug, or exposed to the stress of infection. Is a hereditary condition passed down in families. The disorder is considered a main health challenge in a number of countries, including the United Arab Emirates. The study aimed to explore the experience of mother and their coping strategies with children having G6PD deficiency and to explore the difficulties and challenges that mother faced with their G6PD deficiency children in UAE. In addition, to highlight the role pharmacists in regard to this community. About our objective, explore the experience of mother and their coping strategies with child having G6PD deficiency. Also explore the experience of mother dealing with their children emotion and attitude. Third one, explore the difficulties and challenges that mother faced with their G6PD deficiency children. So about our methodology, it is a qualitative methodology which is phenomenological design was used because the aim is to explore a lived experience of mother caring for a child with G6PD deficiency, which is a unique features and cornerstone in phenomenological research. Semi-structured online interview guided by a topic guide was carried out among 8 participants in UAE with different characteristics. Sample size and population characteristic, 3 different type of non-probability sampling, which are propositive sampling, snowball sampling, and convenience. Interviewed 8 participants, we reached the point of saturation. The status of mother, a mother with a child is under 15 years old who was diagnosed with the G6PD deficiency. At least one child suffered from this condition. Nationality is Emirati. All education level of mother are able included and able to speak Arabic and English. About the ethical consideration, confidentiality of the participant was totally considered. Electronic consent forms were used, encrypted recording were saved. About our result, so the result of our research divided into 2 themes, which are the challenges faced by mothers and their coping strategies with their children. So each theme is consist of similar 6 sub-themes, include the food, medication, symptoms, emotion and information and product. So first theme, which is challenges. So the first sub-theme under challenges is food. We figure out that half of the participants face difficulties in avoiding legumes in the supermarket and limited food options, which can affect all family members' food habits. Sub-theme 2, which is medication. Majority of the participants face challenges in getting information from the doctor about the medication and also limited medication and find the list of alternative medication. Sub-theme number 3, which is symptoms. In general, participant response brought to light that most symptoms that appear are hematuria, blood in stool, jaundice, fever, dyspnea, dizziness, and skin rash. Sub-theme number 4, which is emotional. Participant feeling were mixed, in which most of them mentioned that they felt scared when they first heard about the disease, worry about how to deal with the condition, and feeling difficult to live with the disease. While 2 of the participants, they felt the G6PD deficiency is not a disease. Sub-theme number 5, which is information. In general, all participants face difficulties in obtaining information about the disease from the doctor. Sub-theme number 5, which is the last one, which is a product. 2 of the participants mentioned about the product that should be avoided, which is naphthalene, henna, alcohol, athmad, which is kahal athmad. The second theme is coping strategies. The first sub-theme is food. Almost all mothers, they managed their kids' condition to avoid the disease symptoms by informing family members, school, parent, friend, and restaurant. And about medication, all participants agreed that they have informed the doctor and pharmacist about G6PD deficiency condition in case if there is any disease or interaction could happen. And sub-theme number 3, which is about symptoms, participants manage the symptoms by giving antihistamine medication, transform their child to the hospital, and avoid food and medication that cause side effect. Sub-theme number 4, which is emotion. The participants share their emotional and how they deal with their child, such as understanding the situation, how to inform their family member, how to convince their child about this condition. And something number 5, which is information. Some mothers acquire the information about G6PD direct from the doctor. Some of them gain the information from their experience, and some they search in Google about the information, which mean they searched about by themselves. The last sub-theme, which is product, the participant avoided the product. To conclude, the study showed deficiency in information and support for G6PD children and their families. It is aimed that the finding of this study will shed the light on the disease and provide some recommendation for G6PD deficiency population. The participants suggested establishing a G6PD deficiency community that provide information that is more accurate about the disease. In addition, the study recommends some future practice that could be of a great help to this community. For example, a specialized application that support the community. Also, the pharmacist could be a great help to this community by providing all the trusted medical and nutritional information about the condition wherever and whenever it is needed. So, thank you.